crews were here earlier today preparing to begin construction here at the parking lot just off of Barton Street between Ferguson and Wellington. Now, it is the end of the day, but the area is fenced off, so it does look like work is set to begin as soon as possible. While Hamilton Health Sciences says the province will use the intended facility as a resource when needed. It says hospital capacity is very thin and the system is expecting more out-of-region patients. Front loaders and generators are seen inside this fenced parking lot beside Hamilton General Hospital as work appears to be underway for a temporary unit.
We'll house 80 hospital beds and serve as a provincial resource to accommodate extreme pressures on the healthcare system.
According to Hamilton Health Sciences' Rob McIsaac earlier this week, the field hospital is expected to be operational for patients by next month. The Ford government is using HHS and Sunnybrook Hospital in Toronto as emergency space, intended for recovering COVID-19 patients in the final days of their hospital stay. Across the province, ICU admissions are climbing and capacity is extremely limited.
Joseph Brant, the General, Juravinsky, St. Joe's, and Niagara Health have all received Toronto critical care patients, and we expect more patients will be arriving throughout this week.
Over at Joseph Brant Hospital, Chief of Staff Dr. Ian Prera says ICU is near 100% capacity, half with people infected with COVID. He says the hospital is preparing to expand intensive care space into surgical areas this weekend and is seeing 1 to 2 new COVID patients from the GTA daily.
So those have been all COVID positive patients needing critical care.
Last spring, the hospital built its pandemic response unit, but a bed has not been used since mid-February and has since been repurposed. The 93-bed temporary structure here at Joseph Brant Hospital is currently being used as a vaccination clinic. Prera says the emergency structure does have capabilities to expand into an ICU, but it's intended for mild to moderate COVID-19 patients. He says currently there are no plans to stop vaccinations there, but the hospital would be ready for changes and says it could do so in 24 hours. Now, it does appear that structural work could begin as early as next week.